honoring the service of board member Frank Rodriguez, and I've asked Clark Heydrich to read that for us.
It's an honor to read this. A resolution expressing appreciation to Frank Rodriguez for his service.
Oh, where's Frank? I'm sorry.
Yeah,
Frank, come up here. Sorry about that, Clark.
That's all right. This is a resolution expressing appreciation to Frank Rodriguez for his service to Central Health. Whereas the Travis County Commissioners Court appointed Mr. Rodriguez to the Central Health Board of Managers in 2004 and reappointed him for a second term in 2008. And whereas Mr. Rodriguez served as board treasurer from 2009 to 2012 and board vice chairperson in 2012. And whereas Mr. Rodriguez, as treasurer of the Board of Managers, oversaw the issuance of Central Health's first bond issuance and developed its first organizational budget. And whereas Mr. Rodriguez contributed significantly to the development of Sendero Health Plans, Central Health's health management organization, and serves on its board of directors, an endeavor which expands the availability of quality, affordable health care to thousands of additional Travis County residents. And whereas Mr. Rodriguez was instrumental in increasing access for the underserved by expanding contacts with existing providers and developing new ones, and supported the expansion of respite and inpatient services for crisis mental health treatment. And whereas Mr. Rodriguez engendered meaningful dialogue and successful outcomes among partners and others in the community to discuss not just health care, but also health and wellness as solutions to the health care crisis affecting Texas and the nation as a whole. And whereas Mr. Rodriguez supported such innovative programs as iCare, the Integrated Care Collaborative's Health Information Exchange system to improve the quality of care and outcomes for all. And whereas Mr. Rodriguez has pledged to continue his mission of working tirelessly to reduce disparities in health care and quality of life for the traditionally underserved population of Travis County, therefore be it resolved by the Central Health Board of Managers that the board expresses its sincere appreciation to Mr. Rodriguez for his 8 years of service to Central Health and recognizes the numerous and indelible contributions to the organization and to the entire Central Texas community. And be it further resolved that the treasurer of the board prepare a copy of this resolution for presentation to Mr. Frank Rodriguez.
Thank you, Clark. Frank, comments?
I actually have a speech. After 8 years, I'm hoping that you'll indulge me. And it follows the theme that Anthony talked about learning experience. And so I want to talk about some of the things I learned. So I have some props, they're not elaborate, but it just helps me illustrate my point. So in serving 8 years, first thing I learned when I got appointed was that there's really not a healthcare system. I always thought there was a healthcare system. I learned day one there isn't a healthcare system. So you have these disparate parts of a system, right? And it's like a puzzle that hasn't been put together. And so, the puzzle includes things like that the U.S. spends $1.9 trillion, or 16% of our gross domestic product on healthcare. That's about $7,000 for each person in the United States. And that the 5% of people with the greatest healthcare expenses in the U.S. population spend 49% of the overall healthcare dollar. And that 75 cents of each dollar is spent on chronic care, healthcare. And those expensive health conditions are heart disease, cancer, trauma, mental disorders, and pulmonary disorders. So I learned that a well-functioning healthcare system needs to have key components that respond in a balanced way to a population's needs and expectations. This gets funnier. I mean, just go on. So these expectations are improving the health status of individuals and families, and then defending the population against threats of health, protecting people against financial consequences of ill health, and then providing equitable access to people-centered care. I also learned that the health system has these control knobs, and these control knobs consist of financing. Where does the money come from? Where does the money come from? How's it pooled? How's it allocated? How's it spent? And then payment. How are providers paid for? Hospitals, clinics, managers, physicians. And in the organization, who delivers the health care in what setting? And how are those facilities organized? And the regulation. How are the different actors in the healthcare system, insurers, producers of inputs, providers, and facilities regulated? And then persuasion, the whole issue of personal behavior of providers and patients and how they influence individual actions and interaction with the healthcare system. And then politics. How do healthcare system reformers mobilize the political support needed to bring positive change? And then finally, ethics and values. How does the health system reflect the community's values? So I think that Central Health made some system changes. Even though we didn't have the puzzle put together, we jumped in and we worked hard to make changes in these areas with some significant progress. I think we created this credo that healthcare has to be effective, it has to match the science, but it should never underuse or overuse the best available techniques. That it should be patient-centered, the care should be timely, it should be efficient, seeking to reduce the waste and hence the cost of everything related to healthcare. And that it had to be equitable, that race, ethnicity, gender, income should not prevent anybody in the world from receiving high-quality care. So I learned that the Affordable Care Act, I learned about the Affordable Care Act and I started using the props. So, you know, we had Obamacares, you know, and that those sections of the Affordable Care Act, I actually read the 900 plus pages of it. So I'm going to start pulling out the props. So we have this. So we have this Title I of the Health Care Act. It's this magic wand, and it declares uninsurable people to be insurable. So we got that. We got Title II that expands coverage by giving stacks of money to people who simply can't afford to buy health insurance. Most of them are healthy and already insurable. We have Title III, where we have these new delivery models, payment incentives, and electronic health records that replaced the ballpoint pens that doctors use each year to write orders and prescriptions, roughly over $2 trillion in fragmented, overpriced, and ineffective care. We have Title IV of the Health Care Act that tries to wean us off unhealthy habits like eating too much. I saw this from Dr. Sage, French fries, and to be culturally relevant, tortillas. To help us be more physically active by identifying and funding programs to boost disease prevention and improve community health. Then Title V is committing to an expanded, reconfigured workforce of diverse healthcare professionals and other skilled employees. And in that regard, this is something I've personally been working on through a nonprofit. These are 28 promotores. They were graduated in May, this year, last year, November. 28 that will be working in the healthcare system, Seton, Lone Star, hopefully community care and other groups. And then I learned that by working on a proposition where we can leverage monies and we can improve the system through the leveraging of these funds. So we're bringing in an additional $54 million through the 5-cent tax increase, another $76 million from federal funds for a total of $130 million annually. Now, go back to the magic wand. So now we have this magic wand that's created this 1115 Medicaid waiver. And that's going to allow the expansion of Medicaid managed care and preserving hospital funding, providing incentive payments for healthcare improvements, and directing more funding to hospitals that serve large numbers of uninsured folks. And we have these 7 goals with this 1115 waiver, and I won't go through those, because everybody knows those by heart, right? Mm-hmm. So we created this mechanism. I learned that we created this mechanism that's called the Triple C, the CCC. And so we have this Triple C cafe now that we have this menu of items that we can select from. And so we have things like we can order off. Well, let me read the Triple C philosophy first. So Triple C has always believed in developing infrastructure to improve the health of the current and future regions and populations, in reducing health system costs, improving the patient experience, bolstering population health, supporting prevention, education, and healthy lifestyles, and expanding access. So off this menu, hopefully we'll be able to order off the menu and things like, breakfast, huevo rancheros, and transformation tacos for lunch, and medical menudo we'll have to try for dinner. So in the end, we end up with, it'll be trial and error, it'll be demonstration, it'll be going back and forth, but in the end we'll hopefully have a healthcare puzzle that kind of is put together, so everything kind of nice and forms together in this puzzle. For me, it's been a transformative experience, once in a lifetime, professional, community, and personal. You have the Pre-Affordable Care Act, Frank. I call it Fluffy Frank. where you kind of, I hate to show this picture, but kind of like
Wow.
And so I feel like I walked the talk, and for me it was a transformative experience, and I'm proud of that. But there's work to be done, and I'm going to be around. I'm not going to go quietly to the good night. I mean, I'll be probably sitting there, and I'll be talking about, and you all are keenly aware of this, and you all are working on this, but about the issue of transparency, and the issue of disparities, and population health improvements, and bringing those into the continuum of care. So for me, this whole experience was, as Joe Biden says, it was a big effing deal. And so I ordered these T-shirts. They're not here yet for you, but I did order you T-shirts.
Oh, no.
And it says health reform is a BFD. So that's my story.
Okay.
Thanks for indulging me.
Thank you, Frank. Thank you. Okay, comments. With Brenda.
Frank, truly has been a joy serving on your Budget and Finance Committee for, I guess, almost 3 years. And the one thing that I will remember forever is you take copious notes. You have these old school notebooks and you take notes. And so 6 months down the road, we're at a different meeting. You say, well, my notes going back 6 months ago said, now let's make sure. And so you kept us accountable to what we discussed and what your understanding was. And I thank you for being the note taker, if you will, to keep us accountable to ourselves in terms of what we heard, what we discussed, and what we committed to. Thank you.
This way? Yes.
So Frank, you always did ask those really hard budget questions and those complicated transparency questions, which I always learned a whole lot from. And then you would bring that humor question in, and you would let us all sit back a little bit. We are really going to miss that, especially those Saturday retreats. You might want to come back on some of those Saturday retreats about 3 o'clock. Some of those questions, because we will really miss your insightful questions, and you help us remember to have a little fun while we're doing it. You'll be missed.
Too much to say, Frank. Your loss is huge, and we're going to miss you. And the takeaway I have most I'd like to thank you for is you taught me how important it is to do your homework. Your little show and tell right here is a great example. But you take an issue, you delve into it, you do the homework, and you really become a subject matter expert on many, many things, from the disparity issue to financial issues to anything. But you are one of the most active, hardworking board members I've ever seen, and you've really taught me the value of doing it right. Thank you. I really mean that.
Tom?
I didn't know Frank before we were sworn in on August the 2nd, I guess, 2004, and then we sat down, and Trish came before us and gave us things about community care, which is community care now, about how 10,000 calls coming in a day and not being answered, and how out of money and everything. And then David Evans came and told us how bad the funding was for the MHMR, which is now integral care. And so we had a lot to do to start out, and Frank and I were on the strategic planning committee with Ellen. Ellen was a Travis County employee then and helped us have a, quote, strategic plan. I don't know if you were on the budget committee, but we had Tom Young running around trying to get John Stevens and Christian Smith lined up, and Susan Patero. So it was an exciting time back there, and we got a lot done, and I think what you said, we've made a lot of progress, and a lot of it has been because of you. And I was going to say this, but I'm going to go ahead and say it anyway. You leaving us half the man you were when you came in. I mean that in a good way. That's been the most impressive thing about Frank. The other thing, he told me, his world of experience has been so great. I mean, he's worked for the city of Austin, Pedernales, and several other places. He was the developmental director at Mexi Arte. He plays in a band, and now he's at the Latino Healthcare Forum. And he's just got so many varied interests. And he used to work with Dan Davidson, who was one of my people I respected from my early days in the hospital, and he was the one who turned Brackenridge around back in the 70s and all. And he always told me, he said, when you have the votes, take them. And I wasn't able to use that very much, but I tried to when I was chairman, and so I appreciate that tip. And we're going to miss you, Frank.
Yes.
I just am going to miss you terribly. It's been a great 8 years being your colleague. You're an incredible combination of budget meister and being able to read spreadsheets and understand the numbers, and having a heart and passion for the people that we're trying to take care of. I think that's you've been the conscience, really, of our group for 8 years. Every time those of us that are more on the financial side and thinking about numbers or whatever, you always bring us back to what's this going to do for the people we're supposed to be taking care of. And I think we're going to miss that the most. You've added a delightful sense of humor, which has been needed and much appreciated over the course of our friendship. And I remember one big, all of us who were there at the beginning remember how hard that budget was, and they remember the big debate we had over the corporate seal. And we had doctors, our two physicians, Drs. Coopwood and Patrick, arguing over were we going to have one snake or two on the corporate seal. There were arguments for and against, and Frank finally resolved it by saying that snakes were not highly regarded in the Hispanic community. We went with a no snake seal. But we talked about that a good bit. But I just treasure our friendship, and you've been a wonderful colleague, and we're going to miss you.
Appreciate that.
But I'm delighted that you're going to continue to work with Sendero and be sitting out here. I look forward to that.
I don't know what I could say that hasn't already been said. Every time one of the original board members leaves, I think, wow, that's a lot of knowledge that's going. And we certainly are going to miss all the experience that you've had. And it's already been said that you have been willing to ask difficult questions, and you had all the background material to know exactly how to ask that. But then I also appreciate that you brought levity to many of our meetings. So I in particular am going to miss the commitment that you've shown to our board and to the mission of our organization, and that you carry out that commitment even outside of all the time that you've spent here through your development of the Promotores program and so many other things that you do. I'm going to miss your ability to think creatively, and I think that derives from some of the experiences that Dr. Coopwood described that you brought to your experience here. And I'm definitely going to miss your sense of humor. That's you're an exceptional act.
I just wanted to say one more little thing, that I'm going to miss you as a supporter of my healthcare philosophy, which is tax and spend. You would always it would support my raising the tax rate and spending the money on healthcare. So
Tax and invest.
So we had a meeting 2 weeks ago, was it? Or was it just last week?
Last week.
Meeting, oh God, last week. And I remember looking around and saying, and I asked, where's Frank? Okay? And someone said, well, he's off the board. And I said, no, that's not what he told me. And I was serious, okay? He told me he was staying on until the county commissioners appointed somebody. And then I think it was Tricia was telling me, no, December 31st was his last day. And I said, no. He told me, I was adamant.
I might have told you, I apologize.
And you did, okay, so I'm going to put it on you.
Okay.
But what I'm trying to say there is that it didn't feel right, Frank, not having you here. I really missed you. And I know that I'm going to miss you. I mean, there's only a few of us left now who've been here since day one, and you were one of those, and you know what we've been through together in these 8+ years. You know, how we started, the number of hours that we started on those first few meetings. But
Months of meetings.
Yeah, and one meeting after another, where we were just like meeting from 8 o'clock in the morning till, I don't know, 9, 10 o'clock at nighttime at the beginning. But, you know, I've learned so much from you, and you have such a big heart and so much passion for the Hispanic community. And I look forward to what you're going to do in the future. I'm going to miss you on this side, but I know that you're going to be doing a lot more work on that other side, and I hope that we're going to be able to help you, you know, and support you in what you're doing there. I am going to miss that humor that you have. It was amazing. I don't know that there'll be another Frank. Obviously, we saw it here. I'm going to miss that, because I mean, in the middle of our Saturday retreats, and we're really serious, and Frank would just blurt out a joke or something, you know. So, and that would kind of break the ice and stuff, and I'm going to miss that. But you have, as I do, I know that this past year, every opportunity I got, I would tell my healthcare story, you know, my weight loss that I went through. But you have a bigger one than I do. Oh my God, it's amazing who you were and who you are now. I mean, in size, okay? Like Dr. Cooper said over there, I walk into a room and I will look for Frank and I can't find Frank, okay? Because then all of a sudden here's this Frank, this man that, you know, used to be a larger size man to now, you know, having lost all this weight. It's really amazing what you've done, and I respect you for that. So I'm going to miss you. We're all going to miss you. And we thank you for the time that you've given to us.
Just two things real quick. So one is the weight loss. Is the realization came, you know, the Gandhi paraphrase is, you want to change the world, change yourself. And so I felt like if I'm going to be pounding the desk and talking about, you know, healthcare, then I needed to walk the talk. So that's just simply a practical, I got to do this. The other thing about the sense of humor is when you start talking to people about healthcare, and they come from different points of view about public-private systems and subsidies, and you know, people get upset. So I found out that you got to make people laugh, otherwise they'll kill you. Simply survival is what it was. So I mean, thank you for the kind comments, and you know, we'll be collaborating still and working together, and looking forward to that.
So we also have a plaque for you, Frank, and it has the same words, I think, in here. But I'll just read it quickly. It's creating access to healthcare for those who need it most, presented to Frank M. Rodriguez, in heartfelt appreciation for your invaluable expertise and excellent support of Central Health's mission through your service. Central Health Board of Managers, 2004 through 2012. Thank you, Central Health Board and staff. Let me put this down right here. Again, here's this for you.
Thanks.
There you go.
I move adoption of those two resolutions.
Okay. I have a motion and I have a second. Any discussion? All in favor signify by saying aye. Aye. Any opposed? Very good. Passes unanimously. Yes, ma'am. I sign those? Okay.
So number 4 is now number 2.
Yes.